Hi, everyone. I'm Cliff, and it has been 12 months. 12 months? Well, it's actually been a little bit more like 13, but I wanted to give you the full 12 since I started my disease modifying therapy, Kesimpta, also known as Ofatumamab. Say that three times fast. Ofatumamab, Ofatumamab, Ofatumamab. Hey, it kind of rolls off the. There could be a song for that. Oh.
Yeah. Ofatumamab. You're just another nerdy name for Kesimpta. Yeah.
Okay, so that was ridiculous. But now I did switch from Ocrevus, or Ocrelizumab as it is known also. And that's another CD20 B cell drug, very similar. They're two different drugs, both kind of function the same. And I have my reasons for switching. If you want to see a complete video on my pros and cons of both these drugs and why I switched from one to the other, I'm going to link that in the description below. But this video is actually about what has happened over the last 12 months on Kesimpta. So if you are someone that is considering Kesimpta, or if you're having issues with Kesimpta, watch this video because we can compare experiences, or you can learn about the experience of taking Kesimpta from someone with relapsing, remitting multiple sclerosis. Let's get started on that. Okay, so what I'm going to do is I'm going to break this down and make it easy for people to absorb because I have a lot of memory issues with my MS. So I really appreciate it when people do similar things for me by creating lists. So this video is going to be the top 5 things I like about Kesimpta after 12 months and the top 5 things I don't like about Kesimpta after 12 months. Let's get started on that. Now, this is important. I'm not a healthcare provider. I'm not a doctor. I'm none of that stuff. I'm just a random dude on YouTube with MS sharing his experience with Kesimpta over the last 12 months. This should not be construed or taken as medical advice. It's just my experience, and I thought sharing is caring. And if we can all share our experiences and find common ground in there, maybe we're helping each other. Now, the top 5 things I do like about Kesimpta after 12 months. I'm going to start with number 5. It works. I think it is slowing the progression of my disease. I definitely feel better, so that's good. Though I won't know for about another 4 to 5 months if, via an MRI, if there's any more damage to my spine or my brain in sense of lesions or brain atrophy or any of that stuff. But I'm just going by how I feel, and I'm definitely feeling better. Before I was on the Kesimpta, I had a little bit of a break between Ocrevus and Kesimpta, about a year and a half, and I did notice that my disease was feeling a lot more progressed, like things were getting worse. Now, is this a result of total lifestyle change and dietary change and exercise and all that stuff? That probably has a lot to do with it. And to be honest, Kesimpta and the CD20 drugs never claimed to stop symptoms. They claimed to stop progression, and that can only be measured with MRI. So I don't really know if it just halted the progression, but I feel like it is definitely doing its job. So that's number 5. I'm pretty sure it's working. Number 4, it's easy. Compared to Ocrevus, where I had to go into the infusion center and sit there for almost 6 to 7 hours while they did the infusion, that was a long day for me. And if you saw my other video, you know I don't like sitting around very much. And so to sit in one spot for 6 to 7 hours, hooked up with wires and pipes and all that stuff, it just was not for me. I did not like it. And also, I think there was a lot of side effects from all the prophylactics they gave me before, which is like Benadryl and Zofran for the nausea and all that stuff. Kesimpta is a much smaller dosing drug because I take it more often. So I don't really have what I believe to be the negative side effects from the prophylactic drugs. The Kesimpta is a 5-second jab in the flab in the middle of my gut, and I am done. Number 3, no crap gap. This is a big one. So the main reason I stopped Ocrevus, other than the extremely long infusion times, was because of the crap gap. If you're unfamiliar with the crap gap, I will link a description below and you can read more about the crap gap. Basically, for me, it felt like that Ocrevus infusion stopped working after 3 months and all my symptoms started coming back and things started getting bad again. And I had yet another 3 months to go before I could get my next Ocrevus infusion. So that was really rough. I have not experienced that with my Kesimpta. I will note that 4 to 5 days before I'm due for my next injection, I do start feeling kind of crappy. So is that related or not? I don't know, but it is definitely consistent. So I have to think there is some relation there. Number 2, it's really easy to plan around because it only takes 5 seconds. I love that. Before, with the infusion stuff, I had to schedule the infusion time. I had to have someone drive me there. I had to have someone pick me up. I had to sit there and do all that stuff. This is like, with the Kesimpta, it's like brushing my teeth. Like, I go in, I usually do it in the bathroom right as I get out of the shower. I grab the flab on my gut, I jab it, 5 seconds, put a Band-Aid on it, and I'm done.
And this is really simple. 1, 2, 3, 4, 5. And it clicked for a second time and it's done.
I can go on with my day. Now, I do start feeling the effects of the Kesimpta within about 4 hours, and we'll get to that in the cons, but that is something that happens and something to be mindful of. So stay tuned for that one. Number 1, you would think would be like, oh yeah, it's definitely working and that's awesome. And number 1 reason why I love this stuff is because it's awesome for my multiple sclerosis. But for me, it's something much more than that. It cured me of my lifelong needle phobia. Like, I had a needle phobia like you wouldn't believe, or maybe you would believe because you're living it. It was crazy. And with this multiple sclerosis thing, we get lots of pokes and prods, lots of blood tests, all that stuff. And I found that by basically manning up and being able to give myself my own injections, it really reduced my anxiety of getting hypodermic needle stuff tests done on me almost completely. Like, I am so much more relaxed about that now. I never thought in a million years I would be able to actually get there mentally because I had such a phobia of it. But now it just doesn't even really bother me. So number 1 is like, it reduced a super huge phobia that I had. And I'm really happy about that. So I know that sounds weird, but that is the case. So if you have extreme phobias about that kind of stuff, that first injection is very difficult, but after that, it gets a lot easier. And by the 3rd or 4th one, you're a pro. That's how I feel about it. So without hesitation, let's get into the cons or the bad stuff about Kesimpta. And these are my top 5. Let's start off with number 5. Number 5, it is insanely expensive. I'm looking at like $8,000 to $9,000 per dose. Remember, these are monthly doses. And so you have to have insurance to cover this stuff, and you have to have good insurance to cover this stuff. And that has been problematic for me because my wife and myself are self-employed. And we made the transition from corporate America, good insurance, to not having any insurance, to trying to figure out how we were going to do insurance. And that became an issue with these MS drugs because of the price of them. And I'll cover that more as we get through this list. Number 4, the side effects can vary in intensity and length. And so while I'll say the side effects are nowhere near as bad as what I experienced on Ocrevus, the side effects with Kesimpta can range. Sometimes when I take it, 4 hours after I take it, I'm wiped out for the rest of the day. Sometimes I'm not. And then, as in this last episode, my last injection, not too long ago, it took me out for a good day and a half. And I'm not talking like, oh, I'm just kind of a little tired. I was completely wiped out. So that hadn't happened in like the 6 injections prior to that. Now, I will say the ramp up when I first started was pretty rough. Just be prepared for that if you're considering this drug. They may not affect you at all, and they may always affect you. I don't know. That's just been my experience. Number 3, since you have to get it once a month and it shows up at your doorstep, and getting it to your front doorstep can be quite a fiasco if you have the wrong pharmacy. Now, I'm not going to put anybody on roast here, but I had a good pharmacy originally, and it worked really well. I had a bad pharmacy the second time around, and it was a huge pain in the ass to get my drugs. Like, it required a 45-minute phone call. It required sometimes multiple phone calls, and it required waiting on the phone call while they called other people and blah, blah, blah. For something that was completely routine, it seemed to be a challenge every single time. So it can go one of 2 ways. It can go either really easily or it can be a huge pain. So if you're having that experience, I would absolutely recommend you look into switching pharmacies. And pharmacies are different everywhere. So I can't really make a recommendation on which one to use. It's all based on experience. But if you're having a bad experience, I'm pretty sure there is a better experience waiting for you if you do a little bit of homework. Number 2, the fatigue is just something I've learned to deal with. And I'm not talking about the fatigue of MS. I'm talking about fatigue from the drug. And it's not the kind of fatigue that wears off after a couple of days. There is the extreme fatigue for a few days, but then there's this everlasting fatigue that once you go off the drug, you immediately notice within about a month. And I definitely, when I went off the originally felt a lot better. And then when I went back on them, I noticed that like the long-term fatigue came back. And it's just something I have to deal with. It requires some medical intervention, if you will, from my doctor in terms of prescribing something to deal with fatigue. I have videos about that too in my channel. You may want to look at those. It helps, but it's not great. Those have their side effects as well. So the fatigue is really not fun, and I'll put that in number 2 because it affects me every single day. And number 1, this is a personal. Okay, number 1, again, I don't know what happened to that footage yesterday. It got all boogered up, but I'm reshooting it. So number one, and again, this is a personal gripe. Maybe it's not a personal gripe. I would guess a lot of people probably have this issue, but the medication is just too dang expensive. I know that was number 5 on this list, but it made it back on the list to number 1 after I thought about it. I originally had something else, and I was like, no, number 1 is definitely the price, because I think it locks a lot of people out of the market that need this and could really benefit from it. But the prices are so exorbitant. It just pains me to think about people that can't afford it and can't get it, and therefore they're suffering from MS. If you don't have good insurance, you really start feeling the pain from that. And I've been in that position. Now back to the part of the video that didn't go corrupt. So in conclusion, it seems to be working. Now, I won't know that for sure until April when I get my next MRI. It was only really approved for reducing relapses and lesions. So the fact that I'm feeling less symptomatic tells me that there's a good possibility that it's actually doing what it says it does. And again, I won't know until we quantify and qualify that. But I feel better all around, and that's probably a combination of lifestyle choices and learning from experience. So that's my update. I hope you found this information helpful. And if you have an experience that's similar to this or vastly different, please comment below on your experience with Kesimpta, because I know a lot of people that are researching what drug to take next look at my videos because they're from a patient's perspective, and I bet they would love yours too. Most importantly, I think at the end of the day, what I would like for someone who's considering this drug to be able to do is walk into the neurology appointment with a list of questions that they learned online from other patients so they know what to ask the neurologist, and that will help guide them in the right direction for their right treatment. Thank you for watching. I appreciate each and every one of you. This is a damn hard disease, but we are making a difference by sharing knowledge and experience. I'm Cliff. This is Life with MS, and I'm out.
Yeah. You're just another nerdy name.